Molo sisi. Kunjani? Siphilile. Hayi mahlala. Okay. All right. Let's get you seated. Okay. Nganqed?
Kwenzelwa amazinyo.
Aqanjelwa amazinyo. Okay. Aqaqamba nini njani?
Aqaqamba xana ndiphunga into eshushu, xa ndiphunga into ebandayo ayaqaqamba.
Okay. Ayavusa ebusuku qaqamba?
Awafana ndivuse kodwa xa ndisela amazinyo abuhlungu.
The source of sensitive teeth, when one has seen that you actually got clean teeth and you've got no holes, you probably don't have bone disease because I didn't see any sign of gum disease. But I would like to think that there's something else that's causing your teeth to be sensitive. Again, most of the time your enamel is very thin from brushing improperly, because some people brush away the top layer and leave the sensitive layer exposed, which is the dentine. When you hold your toothbrush, because of these circular movements or pattern or anatomy of the gums, you should actually be brushing in alignment with them. Rather than scrubbing, when you scrub you do that.
Okay.
Rather go in circles. So you need to really get like a smallish toothbrush, not the kids one, but there's a medium size which can get to the back for an adult, and then you can clean all around, on top, on the sides, everywhere else. All we need to do, I think, is to just have your teeth cleaned, polished, and we will reinforce them with fluoride. Okay. There's no difference or anything special about managing an HIV patient and managing a non-HIV patient. You understand? So when you've got HIV, we're not going to now come get the whole team and we mask ourselves more than we would normally do. There's nothing special about it. We just take the usual precautionary measures. We use sterilization. I showed you the instruments are sterilized. All of this that we're going to use, this thing you're sitting on is going to be thrown away. This is going to be thrown away. Everything, this gets sterilized with alcohol, and everything we use is disposable. This is going to go inside your mouth. It's highly throw it away, pull it out. Don't be scared. Pull it out and throw it away, and we sterilize the rest. It goes in there. Right. Now we're going to clean. Okay, this is a fluoride, high concentration of fluoride, okay, stannous fluoride. It's going to help make your teeth stronger and less sensitive to temperature differences, okay. We keep it on for a minute or less, and then you should be fine. That's it. Wonderful. Okay. Come to the dentist twice a year, okay? We'll see you soon.
Okay.
Okay.
Thank you.